She might pretend that
He's got people all out here. She can brother to laugh.
We have all kinds of, she's still watching. She really is.
Yeah, we're talking a group. Is everybody ready?
We're going to eat breakfast with them.
Like you can say somewhere, like you're in high school, but instruments for the experiments.
All right, I'll take care of it.
Speak Spanish.
But you know, a lot of that is the last 6 months.
Is everybody ready?
Yeah.
This is Mauro Longoni and Meaghan from Massachusetts, and they're here to talk about genetics, and they're also part of the study that's going on in Boston, and I encourage all of you to join, really. Participate, everyone who can. I know some of the non-survivors can't, now, maybe sometime in the future we can do something, but absolutely anything that any of us can do to help future CDH babies, we should all participate in, and please talk to them afterwards and get some information on the study.
So I think also maybe wants to thank CHERUBS and Tom for inviting us, because it's really a nice setting to be here and to learn a lot actually about CDH too. So we work at the Pediatric Surgical Research Laboratories at the Massachusetts General Hospital. Fortunately, it's orange, so you can read it here. So this is my first slide. After listening to the talk and the discussion before, I hope it's not like a anxiety generator, because you know there's genetics, there's environment, and we talk about salad and stuff you find in the salad, and you know, this is very important actually. I love this slide, but it's really important to understand what it means and where it goes. So basically, we are doing a lot of studying in genetics. A lot of research goes there for a lot of reasons. First of all, because there's a lot of hints that CDH has a genetic cause, a genetic component. For instance, I'm sure you talked about this yesterday. There are many families in which there is more than one affected. That's a good hint that there is a genetic cause for CDH. Also, there are animal models that have mutations in certain genes and end up having a lot of birth defects, including CDH. That's also a good hint that there is a component of CDH that we can find in the genes. But there is also environment. Environment in genetics means everything else that's not genes. So it's not necessarily chemicals, but also things that are in the blood or the nutritional status. This is very hard to define. It's always very subtle, and it's a modest component in causing CDH. So it's very hard to assess. So while genetics, now we can study with very powerful technologies. The environmental component, we still have to study with epidemiology. So we have to look at very large number of patients and do a lot of very subtle studies to identify those minor components. But definitely there is an interplay between the two. So it's not like there is a lot of genes of CDH and that's the only answer for CDH. So it's both genes and how they play out in a person because of the lifestyle, because of things that happen in the pregnancy and so on. So when we deal with genetics, we have to realize that genetics is the field of science that studies how traits are inherited across generations via the DNA. And the DNA is a molecule that's tightly packed in every nucleus of our cells except for a few types. And genetics also deals, in a broader sense, with the effect that DNA has on health and on disease. And of course, you know that in some children, CDH is part of a broader genetic syndrome. This means that not only There is CDH, but there are also other things that happen along. And geneticists and genetic counselors are the specialists that are trained to recognize and diagnose these specific syndromes. The reason why we are so concerned in our study and in many genetic studies with rare genetic syndromes that certainly don't account for the majority of patients that have CDH is because they are often pure examples of what's going on in CDH. But oftentimes they are a single genetic lesion or a single gene that causes the entire effect and the entire spectrum of the disorder. And so they're very interesting because they provide us with the knowledge of the mechanisms, and they point us to the genetic pathways that are important in playing out. So when a geneticist looks at a CDH baby or a CDH person, his job is to observe, to define, to classify very specifically what's going on. Most of the CDH cases, at least the majority of the CDH cases, are going to be isolated findings. So CDH is the only finding that you see. Some other cases are called CDH plus, and I'm sure we talked about this yesterday.
Actually, you're doing new territory, which is good.
Yeah, I was worried that there was some kind of overlap, but hopefully not. So when we have a CDH plus, it means that there are other elements that in association with the CDH gives a larger spectrum. And you see here, these are different components. That's an example of how different components add up to the phenotype, so to the expression of the genes into the person. Some of those CDH cases are true syndromes. So CDH plus is these are all the organs and the tissues where the additional malformations are most commonly found. So they can be found in the heart, they can be found in the brain, in the limbs, in the eyes, or in the genitourinary system. And these balloons show us how frequent they are. So you see the majority of the associated abnormalities will be in the heart, and a little bit less in the brain, in the limbs, and in the genitals. This changes a little bit according to the statistics, but they're quite similar in their frequency. See. So this is what the geneticists do when they do their genetics exam. First of all, they take a family history. This is very important for geneticists because they really want to determine if CDH occurs multiple times through the family, sometimes in hidden ways. So maybe an uncle or an aunt or a grandfather has some kind of phenotype, some kind of expression of their genes that is not CDH, but we know it's related, or it can point us in the right direction. So family history is always very important. And then we do a review of the medical history of the CDH patient and take measurements of many parts of the body. This is a little bit funny. This is something that's specific for geneticists, I think. We really take like a measure, what do you call it? The tape.
Measuring tape.
Measuring tape. We take the measuring tape and we measure the limbs and the trunk and the legs and the face and the distance between the eyes. All these are very important because then we plot them onto tables that are norms. They are called norms, and we find out special features that also help point in the right direction when we do the diagnosis. This is very important for the syndromic patients rather than for the isolated patients. And then we take a close look at the face. And sometimes also taking pictures of the